Autacoids are substances formed in various tissues, have complex physiologic and pathologic actions and act locally at the site of synthesis. They have a brief action and are destroyed locally. Hence they are called local hormones and differ from true hormones. The word autacoid is derived from Greek, autos self akos remedy. Histamine and antihistamines. Histamine. Histamine, tissue amine, histos equals tissue, is an amine formed in many tissues. It is also found in the venoms of bees, wasps and other stinging secretions. Histamine is released in the body from mast cells. Histamine acts on H and H3 receptors. Actions. Histamine produces hypotension, increases smooth muscle tone causing bronchospasm, diarrhea and increased gastric secretions. Histamine stimulates sensory nerve endings causing pain and itching. Histamine is a neurotransmitter in the CNS. Antihistamines. Antihistamines are histamine antagonists. They can be H receptor blockers and H receptor blockers. Drugs that competitively block histamine 5 receptors are conventionally called the antihistamines. H2 blockers are used in the treatment of peptic ulcer. Classification of H1 blockers: sedative diphenhydramine, dimenhydrinate, promethazine, phenyramine, chlorpheniramine, cyclazine, meclizine, buclizine, mepyramine, triple-enamine. Non-sedative fexofenadine, astemazole, loratadine, cetirizine. Actions. 1. Blockade of actions of histamine. H receptor antagonists block the actions of histamine on H receptors. They block the histamine-induced effects on smooth muscles of the gut, bronchi, blood vessels and the triple response on skin. 2. Sedation. Antihistamines cause drowsiness, dizziness and inability to concentrate. The degree of sedation varies from one drug to another. 3. Antimotion sickness affects several antihistamines prevent motion sickness and vomiting due to other labyrinthine disturbances. Some of them also control vomiting of pregnancy. 4. Antiparkinsonian effects. Antihistamines like orphandarine, diphenhydramine and promethazine suppress tremors, rigidity and sialorrhea, excessive salivation, in Parkinsonism probably due to their anticholinergic properties. 5. Anticholinergic actions. Many of the H blockers have anticholinergic properties. Adverse reactions are mild and on continued use tolerance develops. Sedation, dizziness, motor incoordination, inability to concentrate make driving dangerous while on antihistamines. Anticholinergic effects like dryness of mouth, blurred vision, constipation and urinary retention may be troublesome. Epigastric distress and headache can also occur. Many of them are teratogenic. Dysmorphology. C. Newer non-sedative antihistamines, also called 2nd-generation antihistamines, have the following advantages over classical antihistamines. No sedation because they poorly cross the blood-brain barrier. No anticholinergic side effects as they are pure H blockers and do not block cholinergic receptors.